Welcome to the Advanced Graduate Certificate in Addiction Studies program in the Department of Counselor Education, School Psychology, and Human Services. My name is Tam Millar, and I'm a faculty member and one of the contact persons for the certificate program. In this video, I will provide you with information on the requirements, the addiction courses that we offer, and general information on the LCADC and LCADC licensure. There are good reasons to pursue our certificate program in addiction studies. Perhaps you are passionate about helping those affected by addictions and interested in obtaining more information, more in-depth knowledge of addictions and addiction-related issues. You may have had some experience working in the field, the helping field, and you want to formalize your education in addictions, or you want to take addiction courses to obtain a license to treat addictions or co-occurring disorders in a shorter time. As per the Nevada Board for Drug and Alcohol Counselors, without any coursework in addictions, counselor interns need 4,000 hours of supervised addiction counseling before they can take the board exams and become licensed. By taking 12 credits of addiction courses, which is 4 credit addiction courses, counselor interns can have their required internship hours reduced to 1,500 hours. If drug and alcohol counselors interns practice counseling full-time under supervision, it would take them about a year or a little less than a year to complete the 1,500 hours, as opposed to 2 years or longer to complete the 4,000 hours. So if you are interested in the Advanced Graduate Certificate in Addiction Studies program, here is important information to note. The application due date is January 15th. Applications are available on the UNLV Graduate College website. For this program, you will need a total of 12 credits. Again, that is for 3 credit courses to complete the program. And here are the courses that you can choose from. CED 735, Addictions Counseling. It's offered in the summer. Please note that if you are currently in our counselor education or master's program, this course is a required course in your program already. Therefore, it cannot be counted toward the certificate program. In the fall, we have 3 courses to choose from. CED 620, Identification, Assessment, and Treatment of the Process Addictions. This is a co-occurring disorder course. And CED 639 is Problem Gambling Counseling 1. CED 745 is Assessment, Treatment, and Case Management Addictions. In the spring, we also have 3 courses for you to choose from. CED 640, Problem Gambling Counseling 2, the continuation of CED 639. We have CED 645, Trauma and Addiction, and CED 610, Eating Disorder. Again, you can choose 4 classes from this list. Now, if you wonder why someone would want to pursue an LADC or LCADC, LCADC stands for Licensed Clinical Drug and Alcohol Counselor. LADC stands for Licensed Alcohol and Drug Counselors. To be able to provide addiction counseling or treatment in the state of Nevada, a clinician needs to have acquired formal education in addiction, experience in practicing addiction counseling, and the credentials to treat and diagnose substance use disorders. So you not only need the scope of knowledge, but also the scope of practice to treat addictions. And there is an increased need for substance abuse treatment in Nevada, especially with the opioid epidemic in the US over the past few decades. So another reason to pursue an LADC or LCADC is the opportunity for licensed addiction counselors to become state-approved supervisors for drug and alcohol counselor interns once clinical supervision training is completed, approved, and certified by the Nevada Board of Examiners. Now, LCADC is a unique license. Clinicians with LCADCs have a broader scope of practice than LADCs. Clinicians with LCADCs specialize in treating co-occurring disorders. Co-occurring disorders refer to the coexistence of both mental health and substance use disorders, such as having a diagnosis of PTSD and a diagnosis of alcohol use disorder simultaneously. The prevalence rate for substance use disorder is about 20% of the US population. And approximately 21 million adults in the US are diagnosed with both a mental and substance use disorder, which is about 6% of the population. And research has found that integrated treatment that addresses both substance use and mental disorders leads to better outcomes. As we can see, there is a need for LCADCs. There are similarities and differences between LADC and LCADC licenses. Before I continue, I need to make a disclaimer that I am not representing the board, but only sharing information that you can directly obtain from the board. The website is available right there, alcohol.nb.gov. That's where you can go and look for more information, more specific information about the process. Both LADCs and LCADCs can provide counseling to a person with substance use issues, including assessing, diagnosing, treatment planning, and making referrals. Both can conduct testing for which the counselor was trained, and both can provide counseling to a person who has a significant relationship with an identified or suspected abuser of alcohol or drugs, only to the extent necessary to treat the identified or suspected abuser, or engage the identified or suspected abuser in treatment. The one difference between the two is that LCADCs can provide counseling to a person with both mental health and substance use issues. That is co-occurring disorders, to include assessing, diagnosing, treatment planning, and making referrals. LCADCs can also diagnose and treat a person with mental illness who has a history of substance abuse issues or substance use disorder, except for mental illness disorders, mental disorders with psychosis. If you are interested in becoming an LCADC to work with a population of clients with co-occurring disorders, you first apply for the LCADC intern status. If you have yet obtained a master's degree, you apply for the CADC intern status. You will need supervision from a board-approved supervisor and supervised counseling hours. You can work on obtaining internship hours while you are taking classes in our certificate program. Once you have acquired the required supervision hours, again, 1,500 hours if you have taken the 4 addiction courses, and obtain a master's degree in a social science field, you can complete the LCADC application to be reviewed and approved by the board before taking the written and oral exams. For LCADCs, you would take both the National Clinical Mental Health Counseling Exam and the Advanced Alcohol and Drug Counselor Exam. You then will take the oral exam after passing the written exams. And then you become licensed as an LCADC after passing the oral exam. So to obtain the most current information on the licensing process, you can contact the board or visit the website at alcohol.nv.gov. And for more information about our Advanced Graduate Certificate and Addiction Studies program, you may contact Dr. Dahl at heather.dahl@unlv.edu or me at tam.vilar@unlv.edu. Thank you for your time watching this video and your interest in our addiction certificate program.